day everyone, my name is Trishan G. Martinico from BSN2D, and today I will be discussing about the administering intramuscular medication. So the purpose of this is to deliver ordered medication to the muscle tissue. The materials are the medication administration record or the electronic medication ticket pen, appropriate size of syringe and needle for the type of injection and viscosity of the solution, and next is the disposable gloves, which is optional, and then alcohol swabs, medication to be administered, 3 ml syringe, which is 21, 22, 23 gauge needle, and the medication tray. So the procedures are, first we should perform the hand hygiene, which is washing your hands with soap and water or sanitize. It is to prevent the microorganisms from transmitting. And the next is to prepare the medication adhering to the 5 rights of drug administration for the right medication drug for the client. Identify the client by checking the identification bracelet and by addressing the client by its name to have the right medication given. Next is to explain the procedure and the purpose of the medication to the client for the cooperation of the patient. Next is to verify the allergies that is listed in the medical record or electronic medication record to avoid the medications that would harm the patient's health. Don gloves to avoid contamination of the medication. Select the injection site appropriate for the client's size and age. We must be sensitive and sensible to our patient. The next is to assist the client into position for comfort and easily visibility of the injection site for easily and accessible performing of the procedure. Next is to cleanse the site with alcohol swab to wash away the microorganisms. Remove the needle cap for able to us to get ready for injecting. Pull the skin taut by at insertion by using the following sequence. Place the thumb and index finger of non-dominant hand over injection site, taking care not to touch cleansed area 2 from a V. Pull the thumb and index finger in opposing direction, spreading about 3 inches in fingers for less pain and to surely secure the needle and to have an accurate result of the procedure. The next is talk to the client and warm an impending needle stick to let the patient become aware. Quickly insert needle at 90-degree angle with dominant hand as if throwing a dart. The exact procedure in performing the intramuscular medications to avoid errors. Move the thumb and first finger of non-dominant from skin to support the barrel of the syringe. Place fingers on the barrel. Pull out the needle and apply pressure. Pull back the plunger and aspirate for blood in return of the syringe to avoid blood from bleeding. If blood does not return when aspirating, pulls the needle out, apply the pressure to the insertion site and repeat injection steps. It is to avoid the blood from bleeding. Next is, if no blood returns, push the plunger slowly and smoothly. Encourage the client to talk or take deep breaths. Less pain and for the patient to relax. Remove the needle at the same angle as it was inserted for the less pain and avoiding blood to bleed. Massage and lean insertion are with second alcohol wipe. If contraindicated for drug, apply firm pressure instead for the blood to circulate and avoid bruise. Place the needle on the tray, do not recap. Contaminated needle does not need caps for purposes. Remove the gloves. Remove contaminated gloves when done using. Reposition the client, raise side rails, and place bed in lowest position with the call light within the reach. For comfort of the patient and not letting the patient fall from the side of the bed. Discard equipment appropriately. Not in use equipments must be thrown away. Next is to perform hand hygiene to avoid transmission of the microorganisms. Then document administration and the medication record for accurate dosage of drug in the next assessment. So the attitude of the student nurse should accept the constructive suggestions and criticisms, opens to all suggestions and criticisms from errors, assumes accountability for the improvement and betterment of oneself.